Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as sodium oxybate. Its brand name is Xyrem. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe sodium oxybate. We'll then touch on an example of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So sodium oxybate is a central nervous system depressant. Its effects are thought to be mediated through gamma-aminobutyric acid, or GABA-B, actions at the noradrenergic, dopaminergic, and thalamocorticoid neurons. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in cataplexy and narcolepsy, or cataplexy caused through narcolepsy. We may see it used in excessive somnolence associated with narcolepsy. Now we'll define some terms here. So cataplexy would be a sudden, brief loss of voluntary muscle tone triggered by strong emotions such as laughter. Narcolepsy is a sleep disorder characterized by excessive sleepiness, sleep paralysis, and hallucinations. With respect to contraindications or reasons we would not be able to prescribe this medication to a patient, well, we wouldn't give it to a patient who is also using alcohol, so this medication cannot be used with alcohol. It cannot be used with other sedative hypnotic agents. As well, if a patient had a succinic semialdehyde dehydrogenase deficiency, they would also not be able to use this medication. Now for an example of dosing with sodium oxybate. So in the treatment of excessive somnolence associated with narcolepsy, we may see an initial dose of 4.5 grams nightly given in 2 divided doses. So the first dose might be at bedtime, and then the second dose may be 2.5 to 4 hours later. The patient has the option to increase the dose gradually by up to 1.5 grams per night, once weekly. The usual dosing range would be 6 to 9 grams per night, and the maximum dose would be that 9 grams per night. Again, this would be given in 2 divided doses. As with all medications, there are some side effects or adverse reactions that patients may experience while using sodium oxybate, so I'll go over some of those here now. Some common side effects would be decreased weight, which may happen 13% of the time, a decrease in appetite, which can come in at 9%, 8 to 20% of patients may experience nausea, and 2 to 18% may experience vomiting. 8 to 15% may experience dizziness, and a headache may happen 17% of the time. Somnolence comes in at 1 to 8%, and a tremor at 2 to 5%. Nocturnal enuresis may happen 19% of the time, and urinary incontinence may happen 3 to 7% of the time. Now, 3 serious side effects would be CNS depression, confusion, which can happen 13 to 17% of the time, as well as anxiety, which comes in at 1 to 2%. Alright everybody, that's all we're going to talk about today with sodium oxybate, or Xyrem. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description as well. That's it for today. Take care.